We certainly want to move wait times in a direction that trends down, and that is going to take time.
The Manitoba government is now taking steps to reducing wait times in hospitals across Manitoba, an issue that has impacted Manitobans for several years. Dozens of jobs are being posted for healthcare professionals to staff hospitals in Winnipeg, Selkirk, and Brandon. The provincial government putting forward $2.75 million to fund the new staffing positions, which they say will allow hospitals to discharge patients 7 days a week.
By making this investment to strengthen healthcare in Manitoba long term, that not only are we going to bring those discharge rates up over the weekend, but we're actually going to bring the rates up overall.
Emergency department wait times have been a major issue in Winnipeg as of late. At noon on Friday, both St. Boniface Hospital and Grace Hospital were at 10+ hours for wait times. However, earlier in November, wait times at Grace Hospital were as high as 18.5 hours.
Our government is taking that step today to action something that frontline healthcare providers have been talking about and have identified as a way to address the bottlenecks that we're seeing in the healthcare system across different sites.
Azaguera says many healthcare staff have left the workforce over the past few years due to exhaustion and burnout, and now the government is finding creative ways to get them to come back. The president of the Manitoba Association of Healthcare Professionals says allied health is a key part of the solution to Manitoba's ER crisis.
I think that finally there's a government who's listening, that's going to work with us.
Linklater says this investment is long overdue and urges the government to expand community supports to make sure patients have a safe place to go to after being discharged.
Our people who work in the community, our mental health workers, our community case coordinators, all need to have capacity increased as well, so that the people who are discharging patients have a means to discharge to.
Darlene Jackson with the Manitoba Nurses Union says this news will help alleviate some stress for nurses in the emergency department.
We know that we have a lot of bottlenecking in our emergency departments that's due to the fact that those beds are not been emptied. So I'm really positive and really confident that this is a step in the right direction.
In Winnipeg, Karpa City News.